I would certainly say Ride to Care is not reliable.
The last 3 times that I've called them, I've been stranded.
The last month or so, I missed 2 doctor's appointments.
All rides should get people to and from their appointments safely and on time, and anything less than that is unacceptable.
The Fox 12 investigators have been following the concerns and complaints about transportation program Ride to Care. Earlier this month, we told you about a complaint that had been filed against the company that operates Ride to Care. Now, the investigators have learned that come January, an Oregon nonprofit will take over managing Ride to Care. Haley Rush with the Fox 12 investigators has been following the issues surrounding the program for a couple of months and has the latest.
Some of the problems surrounding Ride to Care have been OHP members not getting picked up on time for medical appointments or at all. We've also heard concerns from transportation providers claiming they're not getting paid for providing some of those rides. But we've now learned the nonprofit Care Oregon will soon start supervising Ride to Care, and they want to hear providers' concerns. For some background, Ride to Care is provided by Health Share of Oregon, a coordinated care organization that serves OHP members. For about the last year, Health Share has contracted with a local company called GridWorks to operate it. A communications manager for Health Share has told us the ride confusion and issues usually start at GridWorks' dispatch center. But starting in January, Health Share has asked a nonprofit that provides health plan services for low-income Oregonians called Care Oregon to handle the Ride to Care contract, including managing the direct relationship with GridWorks. But before Care Oregon takes on more responsibility, transportation providers tell me the nonprofit is planning on holding listening sessions with them to hear their concerns with GridWorks. Providers have told us some of what those issues are.
Oftentimes when they go pick up these clients, these members, their members have been waiting for an hour to get to their appointments. And it's just a huge it's a scheduling nightmare. It's logistically, it's just not coordinated very well.
A spokesperson for Care Oregon sent us a statement confirming the listening sessions. It reads in part, these listening sessions are intended to give us information about what is going well so that we can keep it in place and what needs improvements so that we can focus on making those improvements. They did not say when the sessions would take place. A communications manager for Health Share told me Care Oregon being more heavily involved with Ride to Care has nothing to do with some of the issues surrounding GridWorks. During the transition, Health Share says it will continue to work on the overall experience of Ride to Care for members and transportation providers. In the past, GridWorks has told us their highest priority is the health and safety of the people who count on Ride to Care for transportation. And they're continually working to improve non-emergency medical transportation for both patients and drivers. Reporting in studio, Haley Rush, Fox 12 Oregon.